Hello, I'm Sig Ackerman, and I'm the president of Silver Hill Hospital. Thank you for spending a few minutes letting me tell you about our hospital. We've been here since 1931, and we're one of the finest psychiatric hospitals you will find anywhere. I know that's a bold statement, so let me tell you why I believe we can make it. We are an independent hospital, which means that all of our resources go into improving the patient experience of our own patients. We are a strictly clinical facility, which means that our entire focus is on the treatment of psychiatric and substance use disorders. So, who are our patients? We treat an unusually broad range of psychiatric and substance use disorders, and we are especially proficient in treating co-occurring disorders. Many of our patients have failed treatment elsewhere and turn to us for help. We treat patients from 13 years of age through the entire life cycle. We're distinguishable from other psychiatric hospitals in some very important ways. First, we have both inpatient and 7 different long-term residential treatment facilities in which patients live and receive treatment for a month or more. This means we can provide a continuity of care through all phases of illness and recovery, from inpatient treatment during the most acute phases of illness to residential treatment programs that provide the intensive continuation treatment necessary to maximize the patient's recovery and ready him or her for a return to a full life. Each residential program is designed to treat a specific patient population, including adolescents, the severe personality disorders, psychotic disorders such as schizophrenia, substance use disorders, chronic pain disorders, and eating disorders. So treatment selection here is based on what the patient needs and not just on what happens to be available. We have a wonderful staff of highly trained, unusually dedicated, and kind clinicians. Many of them have made their careers here, devoting their skill and compassion to helping the patient's recovery. We focus a great deal of attention on our families. Families have regular individual meetings with the clinical staff taking care of their hospitalized family member. We also offer extensive educational sessions for families to provide them with a better understanding of what their hospitalized family member is dealing with. We have a beautiful campus in a dignified bucolic setting, and over the past decade have completely rebuilt all of our clinical buildings. We believe an important part of recovery from mental illness is regaining one's dignity and self-respect, and our treatment environment, along with the caring attitude of our staff, both help our patients to do that. Finally, patients get better here. We know that from the many grateful comments from our patients and their families, and we know that because we follow up with our patients for 12 months after discharge. So you can see why I think we are one of the finest hospitals anywhere, and why I believe you or your family member will agree. Thank you very much for listening.